Okay. Zoom housekeeping for all participants, you are muted upon entry. For all questions, please utilize the chat box or the Q&A box located at the bottom of your screen. This meeting is being recorded and will be shared on the Hawaii Public Health Training Hawaiʻi YouTube channel. The organizer of this training is myself as the facilitator, as well as 14 members of the Public Health Training Hawaiʻi Steering Committee. We'd like to thank our sponsors for providing CEUs for today, the Western Region Public Health Training Center, the Public Health Training Network, ADAD from Hawaii Department of Alcohol and Drug Abuse, as well as the National Association for Social Work, the Hawaii chapter. Continuing education credits that are being provided today will be CHES, registered dietitians, licensed social workers, as well as substance abuse counselors and certified prevention specialists. In order to receive your CEs, first you must register and attend today's training. Following this webinar, I will be sending you folks a mahalo email that includes the evaluation. Please complete that evaluation form by next week, Wednesday, April 26th. I use that to collect everyone's information and then send out certificates of attendance no later than Friday, May 5th. For folks that are calling in today, please email me at makamae@hifi.org, makamai@hifi.org with your name and phone number that was used today. And for folks that are missing their certificates after 2 weeks, please email myself or the Public Health Hawaiʻi at hifi.org email account. Before we get started, I would like to introduce our guest speaker. Dr. Mercado is currently the Director of Food Systems and Resiliency at Hawaii Public Health Institute and is part of the core group of Transforming Hawaii's Food System Together, a multi-stakeholder initiative to develop sustainable food policy for Hawaii. A doctor of medicine with a master's in public health, she has more than 20 years of experience in public health, including 15 years at the World Health Organization. She's an advocate for universal food and nutrition security as a public health concern. Dr. Mercado is on the board of medical advisors of the Legacy of Life Hawaii Foundation and is board member of the Ladies of the Hawaii Order of the Knights of Resolve. So without further ado, I'd like to hand it over to Dr. Mercado.
Thank you very much, Maka, and good afternoon, everyone. An honor and a pleasure to be here. I'm going to talk about food security and public health in Hawaii. And throughout this talk, I think we'll be able to zero in on how the food system impacts on health. What are the things that determine the food system? What are the factors or the driving forces? And then what are some of the actions we can take to address food insecurity? So let's go to the first slide. Okay, let's see. Here we go. All right. Okay, so let's go to the next, please. Hawaii is the most geographically isolated place in the world. When I first heard this, I said, is that true? Are we the most isolated place in the world? And it is. You know, it is. We are the most geographically isolated place in the world. And the history of Hawaii is that despite its isolation, the land and the sea has been able to feed its people for many centuries. Next slide, please. However, in the late 1700s, contact with the West disrupted the once sustainable food system of Hawaii. And later in the 1900s, a plantation agriculture replaced the ecologically balanced, diverse, and non-destructive Native Hawaiian system of food production. Next slide, please. So currently, 90% of the food is imported. You heard it right, it's 90%, and 70% of our energy is also imported. So we are almost completely dependent on imported food and very much dependent on imported energy. Next slide, please. The estimate is that at any given point in time, if we were to be cut off from our food supply chain, there would only be enough food for 5 to 7 days to feed our people in Hawaii. Next slide, please. And we know that food insecurity became more pronounced during the pandemic. 76% of food insecure families cited lost employment income due to the pandemic. So supply of food is one thing, but economic buying power is quite another one. So if you don't have money to buy food, then you also don't have access. Next slide, please. Now, I'm going to spend a few seconds on this particular slide just so that we can internalize it. 1 out of 3 children are food insecure in Hawaii. 1 out of 3. And I will talk about the definition of food security in a moment, but that's a number that's bothersome if it's 1 out of 3. Next slide, please. Now, on the flip side of the coin, 26% of the food of Hawaii is wasted. And for those of you who have kids in the school, in the public schools, we know that a lot of food served in the cafeteria is dumped. Aside from, a lot of waste in restaurants, in eating places, but you have food insecurity at the same time. You've got about 1/4 of the food available wasted. Next slide, please. So what is food security? The definition of food security is that all people at all times have physical, social, economic access to sufficient, safe, and nutritious food that meets their food preferences. Let's note that it's not just any food, but that it meets your cultural preferences and the dietary needs, what you need to eat for an active and healthy life. And this is from the United Nations Committee on World Food Security. Next slide, please. Now, there are multiple factors that affect household food insecurity. Of course, income is one of them, and unemployment during the pandemic was a major source of loss of income. Culture is another one, or what people prefer to eat. And then, of course, in our modern world, convenience has become a factor that affects how we buy food. We want food that's shelf stable. And so that means food that's canned or processed, and anything that's processed actually has more salt, sugar, or trans fats than what we need. Next slide, please. So is this a problem only in Hawaii? No, it's a global problem, and it's become worse because of COVID-19. So let's go to the next slide, please. Around the world, more than enough food is produced to feed the global population. But as many as 828 million people still go hungry. After steadily declining for a decade, world hunger is again on the rise. So I think we were seeing some progress, but after the pandemic, from 2019 to 2022, the number of undernourished people grew by as many as 150 million, a crisis which is driven largely by the 3 C's: conflict, climate change, and the COVID-19 pandemic. Next slide, please. So these are the 3 C's that are impacting on food systems. And so the food system is not like a standalone independent system that can withstand externalities. There are external factors that can actually severely affect the food system. And these are some of the examples. All right, next slide, please. So during COVID, we knew that food distribution was a problem because people were getting sick or because of the need for social distancing and the inability of certain groups like Kupuna to actually physically access food by going to a grocery store, for example. And so these are photographs from the Kupuna Food Security Coalition, where we had groups like Chef Hawaiʻi that were distributing meals to Kupuna. And there was more than 1.5 million meals that was distributed at the height of the pandemic. But that's something that's very difficult to sustain over a period of time. Nevertheless, Hawaii did it and made sure that Kupuna had access to food. But this is an example of how a pandemic can affect food access. Next slide, please. All right. Now, climate change is the second issue. And just to give a little bit of a context, 80% of carbon dioxide that leads to global warming comes from fuel fossils. And the United States is one of the countries that has a very large carbon footprint, and reversing the increased heat on the surface of the planet really requires rethinking and acting differently in terms of how we source the energy we need. Next slide, please. Now, speaking of surface temperature, so the heat is coming from carbon dioxide, and you'll see here in this graph that temperature increases with the increase of carbon dioxide. So that red graph, it increases with the increase of carbon dioxide in the atmosphere. So when that happens and the surface temperature increases, we see things like superstorms or floods or unusual snow. So the climate system becomes out of balance and less predictable. Next slide, please. Now, the world has agreed that surface temperature of the Earth should not increase more than 1.5 degrees centigrade by 2030. However, every indication is pointing to the fact that in the year 2030, we will surpass 1.5 degrees centigrade as the increase in surface temperature. And, if surface temperature increased to 4 degrees centigrade, only reptiles or cold-blooded mammals would be able to survive. And so this is really an existential problem for human beings because we are running out of time. It's 2023 and that's 7 years to go. Right now, there are scientists who say that we have already reached the threshold of 1.5 degrees centigrade and it will only get higher. Next slide, please. So what's the impact on food and food systems? Well, apart from the displacement of human beings from extreme weather, like floods or storms or snow or fires, there is the destruction of our habitat and the destruction of our food systems and our sources of food. So that's a very obvious effect of climate change on our sources of food. Next slide, please. Now, of course, escalation of conflict and political unrest also impact on food systems. Okay, so in this particular photograph, you can see all that smoke. A lot of that is carbon dioxide, which contributes to the warming of the earth, and the warming of the earth leads to extreme weather events and destroys the food system. But apart from that, when you have war, you also have disruptions in the food supply chain. So when the war between Ukraine and Russia broke out, the cost of wheat and the cost of fertilizer went up all around the world. And that has been a cause for high prices of food everywhere. Next slide, please. Now, there's a distinction between hunger and food insecurity. And let me just walk through that a little bit because we have to deal with hunger separately from food insecurity, right? So what is hunger? Hunger is an uncomfortable or painful physical sensation caused by insufficient consumption of dietary energy. It becomes chronic when a person does not consume a sufficient amount of calories or the dietary energy on a regular basis to lead a normal, active, and healthy life. Next slide, please. Now, food insecurity is measured through what we call the FIES scale, or FIES. And there we could talk about food security to mild food insecurity moderate food insecurity, and severe food insecurity. And you'll see here, these are all very subjective. There's no way of measuring what amount of food is available for a person or a household. It is about what the individual perceives. So when we say a person is food secure or has mild food insecurity, there is some uncertainty regarding the ability to obtain food. And that is usually evaluated from a perspective of, does a person feel anxious or does a person worry about not being able to have enough food? And then when you move to moderate food insecurity, it has to do with compromising on food quality and variety and reducing food quantity and skipping meals. Now, typically when I talk about this, I'd say, go to the grocery and what you were able to buy like 2 years or 3 years ago is about 50% more in cost than it was 2 or 3 years ago. And so that means you have less buying power. And when you have less buying power, what is it that you sacrifice? What is it that you reduce? Is it the quality? Is it the quantity? And what we've seen, and I'll talk about this in a bit, is that people will sacrifice fruits and vegetables from their budget and from their shopping tray, and will focus on staples like rice or bread or potatoes and proteins. And so we are looking already at a population in Hawaii that's deficient in terms of fruits and vegetables, but with higher prices. The population becomes more deficient in fruits and vegetables, which makes us prone to more diet-related diseases. And then where you have severe food insecurity, this is where you actually have no food for a day or more. And this is reported, some people report this, that they do experience days when they don't have any food at all. Next slide, please. So I would say that globally, we have consistently failed at curbing hunger. This was the 1990 Millennium Development Goals. Maybe some of you weren't born yet when this was done, but eradicating extreme poverty and hunger was number 1 in the Millennium Development Goals, meaning all the heads of states of the world agreed that this is the first thing that they're going to address, but that did not materialize. So let's go to the next slide. And we go to the Sustainable Development Goals, which were agreed upon by the ministers of the world in 2015, where the number 2, so poverty and zero hunger, no poverty and zero hunger, were kind of disassociated from each other. And zero hunger became the second most important sustainable development goals for all of the members of the United Nations. Next slide, please. Now, fast forward, we are now in 2023. The Sustainable Development Goals were discussed in 2015. And to date, the world is not on track to achieve zero hunger by 2030. And if recent trends continue, the number of people affected by hunger would even surpass 840 million by 2030. So instead of going to zero, we're actually increasing. And so, of course, pandemic has something to do with this, conflict has something to do with it, and climate change has something to do with it. Next slide, please. So the idea of providing food for people is not straightforward, although young people would think it's just about food, going to the grocery and you buying it. Well, actually, there are issues around land ownership, viruses, water, soil health, seasons, and climate conditions that would affect, in this particular instance, the production of bananas. Now, that is also affected. This also affects the price of fuel, the shelf life of a product, the transport system, and roads also affect whether or not you're going to get bananas. And then you have customer preferences. And then you have capital, capacity, labor, technology, and quality control that all are part of a system for bringing bananas to you. Next slide, please. And so you cannot change the way bananas will get to you unless we look at the whole system. Oh, let's go back. We look at the whole system and try to see where we need to tweak what's happening, because it's not just about solving one part of the system. From production to distribution to consumption, there are so many different factors that impact on whether or not you're going to have access to something like bananas. Next slide, please. All right, now, the idea of transforming a food system or working on a food system and not having a siloed approach to food, like just distributing food or just planting more food, having a systems view is not new. And in fact, in 2008, the Hawaii 2050 Sustainability Plan mapped out for Hawaii, what we need to do to have a sustainable food system. That was in 2008. And actually, not much happened after that. There was supposed to be food policy councils, or food councils were supposed to have been organized, and that did not materialize. So a second report came out, which was called Increased Food Security and Food Self-Sufficiency Strategy. And again, there was a lot of excitement around this, but not much happened in terms of change on the ground. So COVID pandemic occurred in 2019, and finally in 2021, there was breakthrough legislation that mandated the Department of Education to purchase at least 30% local by 2030. That was breakthrough, because having a big purchaser like the Department of Education that probably spends about $50 or $60 million on food every year would buy the food from the local farmers. And that would mean having $50 to $60 million going to local farmers if the whole amount was going to be used for local purchasing. But it's only 30%. So that would be about $15 to $20 million that could go to supporting local agriculture if we implemented this piece of legislation. Next slide, please. Now, there are 4 pillars of food security. Access is one, and that is determined a lot by price or by location. Availability, this has to do with local production or importation. Utilization, whether we actually consume the food or we dump it. And stability, whether or not we have within society the systems to be able to conserve food for the next generation, not just for ourselves. Next slide, please. And so there is a discussion around supply and demand that is needed. And at the Hawaii Public Health Institute, one of our challenges really is trying to, trying to bridge the language between people who are involved in supply and agriculture and those of us who are involved in demand. As a public health institute, of course, we care about what people eat, what they buy, how much they spend on it, right? And so the consumption part is truly a public health concern. But the supply side is a different set of actors and sectors. And so talking about how do you help meet demand and supply requires health people, education people, understanding the language of agriculture, trade, commerce, etc. Next slide, please. Now, Sharon Hurd, who's now chair of Ag, showed me this, drew these 2 circles, and I never forgot it. And she said the issue is we have to have a bigger space of convergence between what we grow and what we eat. Currently, it is so small. What we grow, we actually export. We export about 70% of what we grow. And what we eat, 90% of that, we import. Next slide, please. So what we want to see is a bigger intersection between what we grow and what we eat. I don't think there's any country in the world that can completely produce the food that the whole population needs. So some level of trade and importation is needed, but certainly in Hawaii, there is a lot of room to grow more food, and particularly the food that we eat. Next slide, please. So the fundamental question, next slide, please, is, do we have a food system that is making us sick? And that's clearly within the ambit of public health. And let's just take a look at some of this data. 41% of the population of Hawaii has pre-diabetes. And this is increasing among young people. 13% have diabetes. I would say maybe there's maybe 10 or 20% who don't know that they have diabetes. And about 1 out of 4 Hawaiians are obese. The estimated direct medical expenses from chronic disease, which is affected by our diet, is about $1.1 billion a year. Can you imagine if all that money went to healthy food, right? Okay, next slide, please. And you've probably seen this before, right? That morphology is changing throughout the state because we're all eating from the same food system. Next slide, please. But let's take a look at something very important and something we care about a lot in public health. And this is from the 2020 data of the state, that adults eating less than 1 serving of fruit per day is 40%. So that's close to half are not even eating a single fruit. Adults eating less than 1 serving of vegetables per day is about 1 out of 5. So 1 out of 5 people are just eating carbs and proteins. And then high school students are eating less than 1 serving of fruit per day. And we should be having about 4 to 5 servings of fruits and vegetables a day. But clearly we are very far from that. Let's go to the next. So why is it important to eat fruits and vegetables? Water and fiber in food increases the volume, thereby reduces energy density. In their natural state, fruits and vegetables have high water and fiber content and are low in calories and energy density. Fat increases the energy density of food, while water and fiber decrease the energy density. So I'm a bacon eater. I love bacon, and that is a very energy dense type of food. By eating 1 piece of bacon, like I'm getting the energy that I would get from eating so much fruit or vegetable, but not getting the fiber or the water that I need in my diet. So this is something that would help reduce population-based obesity. If people ate more fruits and vegetables, it displaces food that is energy dense and of poor nutritional value. Let's go to the next slide. So these are examples of energy dense, low fiber, low nutrient, but cheaper. We call it diabetogenic food, which is easily accessed in our food system. And that's why bringing your own lunch is a good idea, because you get to control what you're going to eat. If you rely on buying your food outside, you have no choice. You're going to end up with something you can afford, something that's energy dense so that you eat, in a short period of time, but that would have low fiber and low nutritive value. Next slide. All right. Now, I wanted to share with you that the concern about diet-related disease and disparities, because diet-related disease is more common among Native Hawaiians, Pacific Islanders, Filipinos, and other vulnerable groups, that the White House, and so the Biden-Harris administration, came up with a initiative which is called Ending Hunger and Reducing Diet-Related Diseases and Disparities. And that was in September 2022. And I've been monitoring this. They had another meeting in March, where you will see that this is a national concern. It is not specific to Hawaii, because our food system is lifted from the mainland as well. We're not really consuming locally produced food if we're importing 90%? I mean, where are we importing it from? We're importing it from the mainland. Next slide, please. Right, so just to go to some of the work we're doing at the Hawaiʻi Public Health Institute, we have an initiative called Transforming Hawaii's Food System Together. And next slide, please. The objective is to create new elements of the food and agriculture economy that integrate sustainable economic development, climate change resilience, and biocultural restoration with community health and well-being. So, as I said earlier, looking at supply and demand, we need to bridge these two worlds, those who produce the food and those who consume the food. And the experts in these two areas oftentimes don't know how to talk to each other. But that's okay, because we have to try. We have to start somewhere and we have to try. So transforming Hawaii's food system together has been a, what should I say, like a way of creating a safe space for the supply side and the demand side to see how they can work together for a healthier Hawaii. Next slide, please. So one of the outputs of transforming Hawaii's food system together is an integrated state food policy framework that will bring new and existing food policy strategies and investment recommendations under a common roof, and to focus them on clear and consistent objectives to drive food system change toward measurable goals. Next slide, please. The audience of this document includes policymakers, decision makers in government, funders, private sector actors, key institutions, and of course, the community and non-government leaders. Next slide, please. So we started this partnership in 2020. It was funded with support from the US Department of Ag. And there were three objectives. First was to conduct applied research that informs the prioritization of necessary food system actions at the community, county, and state level. Second, develop an integrated food policy framework and strategy that define Hawaii's food system scope and structure, which is inclusive of indigenous values and producers' perspectives. And third, implement capacity building strategies to facilitate state agency purchasing and procurement of locally produced food. Next slide, please. And so this is a bit of a busy slide, but it's just to show you that we had an advisory committee and a project management team and a project team. And then we had these circles. These blue circles are knowledge products or research that went through, if you look at the little square at the bottom middle of the page, went through process of dialogues, consultations, key informant interviews, affinity groups, and so on, to come up with the integrated state food policy framework. Next slide, please. All right, so for that first USDA grant, the key was really to engage with as many people as possible. And that's not an easy task. As I said, these are two worlds like Mars and Venus, right? And they have different agendas, they use different languages, but we try to bring them together to see how we can have more food security in the state and have healthier food for everyone. So let's go to the next slide. Now, the engagement results that we reported out was interesting because given the 2 years and what seemed like an endless struggle of trying to get people on board, we had 386 relevant partners, 2,625 individuals gained knowledge on how to access resources, 436 partners were involved in training and technical assistance, 8 collaborators secured new funding. There was $1.5 million of non-federal dollars that were secured, 13 major networks were engaged, and 2,500 indigenous, socially disadvantaged, and underrepresented people were engaged with. Next slide, please. So if you'd like to learn more about our work, communication and public outreach was very critical, and to the credit of one of our main core group members, Albie Miles, we have a website, and you can just take a picture of that QR code and or look up HTTPS Transforming Hawaii's Food System, so you can see more about what we did. Next slide, please. All right. Now, the integrated state food policy framework is written around principles of the Sustainable Development Goals. That didn't happen consciously. It just turned out that you will see the words rights, equity, justice, resilience, sustainability, circular economy, fairness, and governance in the document that we have prepared. These are words that you also find in the Sustainable Development Goals. Next slide, please. Right? So based on the integrated state food policy framework, we have 7 action areas of platforms. The first one is food as a human right, healthy food for all. The second one is social equity and food justice. The third one is food system resilience. The fourth one is agriculture and food system sustainability. The fifth one is food at the center of the circular economy. 6 is sustainability education, workforce development, and fair labor. And the 7th is good food governance. And inside those 7 action areas, there are 18 food system planning elements. I won't read through all of those at this point, but you'll see that it does cover a very wide range of disciplines, areas for action, and even for policy. Next slide, please. All right. The second thing that we are striving to achieve is a strategy for resilience and equity. And the Hawaiʻi Public Health Institute did a piece of work on this last year called Evergreen. This has not been adopted by Transforming Hawaii's Food System Together, but it does capture the values that have been articulated in Transforming Hawaii's Food System Together. And the main one would be restoring relationships with Aina, ourselves, and a shared future. And 3 kind of, what should I say, sort of strategic entry points for work would be food as heritage, recognizing culture, food as medicine. Nowadays, they say food is medicine, and how we can transform the food system, like through produce prescription, so that people would have reimbursements for prescriptions of fruits and vegetables, and then food as power, understanding the critical importance of the community in determining their food future. Next slide, please. We had a food system summit, and this was supported by the University of Hawaii, West Manoa, and some funding from the Kellogg Foundation, where we had more than 100 participants. This was just a couple of months ago. Affinity group process was done November and December, so that people knew what they were going to do at the summit and they had buy-in and ownership. And we had the participation of the newly elected and appointed leaders of Hawaii. An interesting part of the summit was celebration of local food. So we had, examples of what an all local food meal would look like. And it was just really absolutely delicious. Next slide, please. Now, one of the things that we pushed at the Food Summit was a sustainable food systems planning bill. And thus far, it looks like it might pass. This would create a working group that would determine the governance for food systems in the future. So we're hoping that this passes. And otherwise, it's like you have these siloed and fragmented agencies. You've got ag doing its thing, education doing its thing, trade doing its thing, and so on and so forth. If we had a sort of like a multi-sectoral, multi-stakeholder mechanism in government to oversee this, then we can connect the dots in terms of policies, investments, the needs, and the dietary requirements of our people. Next slide, please. What are the challenges? What were our challenges? So what are our insights on this? It's not easy to bring people together on such a big topic, such as transforming Hawaii's food system together. And so access, availability, and time has always been an issue. People are busy. Trust, I think after the 1700s, where we had the slow and steady disintegration of an ecologically balanced agricultural system in Hawaii, that mistrust has continued. Different agency agendas. So different groups have different agendas, and sometimes these meet, sometimes they don't. And then there's the issue of capacity. Like on top of our day jobs, how much more of this work can we do, right? So I would say it's been challenging, but on the other hand, we have found some interesting ways of overcoming barriers. So one of the suggestions was to capture the soul of Hawaii and use the theme of restoring relationships, which is really very, very Hawaiian in its root, right? That we are a relational culture, not a transactional culture, and that involving everyone, being inclusive and yet diverse at the same time is easy to imagine in Hawaiian culture. We have had to crosswalk, synthesize, integrate, and look at things that don't seem related and see how they are related. So having an open mind and trying to reconcile what seem to be disparate ideas has been a way of overcoming barriers, looking for common ground. And then our insight was that we don't need a new organization, but what we need is a social movement. And we need people to be involved in determining their food future. Next slide, please. So what are the key things that we need to do, right? So first, of course, is to support local farmers, ranchers, fishers, producers, so that there will be more food production. Next slide, please. In terms of governance, leveraging on what existing money we have for food and directing that toward local production is very important, because it's not new money. It's existing money that our agencies spend, but directing it not to the farms of the mainland, but to the farmers of Hawaii. Next slide, please. It's very interesting. We can eat more protein and vegetables from the sea. So we tend to like to eat things that come from the can, but this state, everyone lives around the coastline. And I think whatever barriers there are to eating more fish and seafood and seaweed, for example, have to be studied so that we are not just looking at the land as our source of food. Next slide, please. All right. And from a public health point of view, we are working on supporting backyard and community gardening. Now, some people will argue that this is backward, right? What we need to do is to support the farmers. But we in public health will argue that in Hawaii, the context is that people have lost their connection to the land. It used to be that people lived with the land and the land was their sibling, So a friend of mine from Walakay was saying, a group of students came to his farm and were pointing to tomatoes on a vine, right? And said, "What's that?" And he said, "They're tomatoes." And they go, "No, they're not tomatoes. They are tomatoes, and that's what they look like when they're on the vine." So for many young people, you take them to the store, they can name hundreds of brands. Consumer goods are easily identified on social media, in real life. But bring them to the garden and ask them to name 10 plants, and let's see where we'll get with that. So for the most geographically isolated place in the world, it is very important that the people of Hawaii reconnect to the land. And that's why we support backyard and community gardening, because people will not support the bigger policies on food if they don't understand the challenges, the difficulties, and of course the joys of producing your own food. It's something that is, what should I say? It's ingrained in Hawaiian culture, but it is slowly dying. And people are just buying food commercially. As an isolated geographic space in the world, it's almost like we have no choice. We have to learn how to cultivate our own food. Now, there is another, I'm not saying that this will solve the whole problem, but it is part of the solution. It's part of the solution, certainly. I mean, there are certain things that you don't want to encourage people to grow in Hawaii because they won't grow. But there's certain things that just sprinkle the seed and it's flourishing in Hawaii. So why do we have to import that, for example? So the idea of promoting backyard and community gardening is part of health promotion, not just from a nutritional point of view or from the point of view of the money it would save you, but also from a mental health and wellness point of view. The rates for anxiety and depression are very high in the state. And there's a common complaint that we don't have enough therapists, we don't have enough psychologists. Well-being can be achieved to a certain extent by interacting with the natural environment. And by promoting backyard and community gardening, we are hitting many birds with one stone. Next slide, please. So just as this is the closing part of my presentation, we have what we call Hui Malaay, or the food garden Hui. Next slide, please. Which, okay, let's go to the next slide. Okay, which is exploring how people can plant food that they can eat, whether or not they have land. And in this particular example, you can see baskets or old tires or whatever it is, because you can plant anywhere something that you can eat, right? So let's go to the next slide. And we're very happy to share with you that since we started this work a year ago, we learned many things by trial and error, right? But since December 2022, we have distributed over 2,000 bundles of fresh produce with people who are in need. And the food is coming from only 2 small backyard gardens, one at Keahumoa, where I live, and where we have, I think, 16 plots. These are not very big. And from the Council for Native Hawaiian Advancement Garden, where we have 4 plots. So next slide, please. Let me just show you some photographs. So we have young people who join us occasionally for harvesting, and that's great because, you know, they begin to learn. Next slide, please. They begin to learn about what the plants are, how do you cut them, and so on. Next slide, please. And so here you can see somebody who's harvesting Swiss chard, which is really quite expensive in the grocery, but we give this away for free. Next slide, please. And yeah, even some very young farmers, like 5 years old or so, joining us, who are children of some of our volunteers. Next slide, please. And these are some of our volunteers who are loading all of the vegetables from the truck into the truck from the Council for Native Hawaiian Advancement. And you can see the volume of vegetables that we're able to produce from 2 sites once a month, which is given free. Okay, next slide, please. So here we have us, and again, look at this is sweet potato or owala leaves. And the first time we distributed owala, I wasn't sure that people were gonna come and get it, but you know, in 15 minutes, all of this was gone. Next slide, please. So that's our little picture showing what we started with. Next slide, please. And it also included the actual sweet potato. Next slide, please. And this is our most recent distribution. I'd like you to take a look at the back and you'll see the long line of people. Let's play the video. Who are lined up for the food that we are distributing, aside from other types of food that are being given to them. In the beginning, we had issues with this because people were actually pushing each other to get the vegetables. We were advised to kind of pre-pack the vegetables and give people bags. But what we noticed is that people like to choose. And I think that's part of the dignity that should be involved in food distribution, that we don't just put things in a bag and give it to them. What we see is that when you give them a choice, they value it. And we've seen how food boxes are emptied and so much food is dumped from these sites. You can see at the back of this slide, the line of people who are waiting for food. Next slide. So, okay, this is Rufino, who's from our Council for Native Hawaiian Advancement. Next slide, please. And you can see the woman here pointing for what she wants, what kind of vegetable she wants. Next slide, please. And very popular, just a little side comment, was green onions. They really love the green onions. And I looked in the supermarket and they're about $4 for each bundle. We're giving that away for free. And somehow, you know, the kupuna who received this, they're just delighted because they're able to cook something with something fresh. And I think that's, you know, I'm not saying that we're solving the whole problem for Hawaii, but I'm saying that there is proof of concept here that food can be produced and shared. Next slide, please. So these are my last few slides. The Hawaii Public Health Institute is committed to increasing food access in the places where people live, learn, work, and play. Next slide, please. And so we have the Kupuna Food Security Coalition, which is doing amazing work, not just in food, but in wraparound services. The Farm to School Hui, that has been under the Hawaii Public Health Institute for more than 10 years. And quite recently, like 2 years ago, Transforming Hawaii's Food System Together, which is looking at the systems perspective. Next slide, please. So some last personal reflections. These are just my own. They don't reflect my organization or Transforming Hawaii Systems, Food System Together. But for me, the food system is a social determinant of health. The food system can create health or it can destroy your health. And so it is a legitimate and a very critical public health issue nowadays. Trust determines the speed of change. This phrase came from Paula Daniels, who said, you know, you have to build trust among all your partners. Otherwise, they're suspicious of each other and you can't change anything. People need insight to act. Communication and interaction is key. And I found that when people start touching the soil, when they start seeing how they can grow something, they begin to understand how important this issue is for Hawaii. We can rediscover a positive non-transactional relationship with the environment. People chide me for not selling the food that we grow, but my sense is that you know, if we continue to make this about business, we're not going to achieve the goals that we want to achieve. So I feel that sharing of food to a certain extent can be helpful in promoting our public health goals. Now, the last thing I wanted to say, and this is such a sad picture of a dead turtle, right, is that time is not on our side. And people feel so bad when they see a polar bear on ice, but I feel worse when I see a honu on the beach, right, who's dead. And, you know, the challenges of climate change are upon us already. And so we need to work on what we need to work on with urgency. Finally, global public health, next slide, please. Global public health security, oops, I'm missing mine. Okay, global public health security is defined as the activities required, both proactive and reactive, to minimize the danger and impact of public health events that endanger people's health across geographic regions and international boundaries. So people talk about food security in relation to global public health security. This is existential. It's about the survival of the human race. Next slide, please. And so we need to grow what you eat what you grow. And next slide, please. Albie Miles, who has been a very important part of our work from the University of Hawaii in West Oahu, says, if we fix food, we fix everything. And I agree. I think that if we get it right in terms of food, we will address the gaps of COVID-19, the challenges of climate change, and if there is, God forbid, conflict, we will survive. Thank you very much for your time, and I'm looking forward to our discussion.
Awesome. Thank you, Susan, for that wonderful presentation. I'm going to just jump on in. Yeah, folks, if anybody is interested and want to ask Dr. Mercado some questions, please drop them in the chat or in the Q&A box located at the bottom of your screens. She wants to keep it open for the remainder of the presentation. So if you folks want to ask questions, please drop them in here. I kind of had a question. I know for the folks that were on the call, Susan, maybe some folks just aren't involved in some of the work in their communities. Do you have any suggestions for folks that maybe here are in Hawaii that how they could get involved, and then maybe just some general pointers for those maybe on the mainland, if they, how do they get connected to these type of change that we want to be in our communities, that we want in
Yeah,
our
there are several touch points for working on food systems. So I would say, Google it and look for what's close to you where you live. It's like I learned about the resources and I'm still learning about the resources just by being curious.
Mm.
Our work in Hui Malaay is rather small to start because we didn't want to compromise quality we didn't want to compromise quality in favor of quantity. And so currently I would say there are so many groups working on farm to school, working on school forests, working on backyard gardening. Just Google them and see what's out there and get involved. The other thing I'd say is that if you like to plant, just go to the hardware store, buy some seeds, get a container and just try it. Just do it.
Awesome. We have some folks in the chat saying mahalo nui, and somebody said a message, grow what you eat and eat what you grow. When during this work, have you been seeing an influx, like, was it COVID that really changed the scene for climate change? Do you think that this was issues were happening at a slow pace and then maybe COVID just kind of exacerbated it? Or in your line of work and work with public health, have you seen this just kind of our INA deteriorate over time? And if did COVID just expose the need for a lot of it?
I think COVID exposed all the cracks in society.
Mm-hmm.
And inequities is one of them. That, when everything was going well, people didn't care, right? They didn't care about others. They didn't care about kupuna. Well, maybe they did, but it was like all invisible. But then with the pandemic, everything became more visible. And then people began to realize that, hey, we're very vulnerable. What if the port of Honolulu closes? We only have 7 days. And in 7 days, let's say let us just say for the sake of discussion, you can't get anything to dock in the port of Honolulu for whatever reason, conflict, flood, whatever, I don't know. Or the workers get sick because of some kind of pandemic. And that happened in COVID-19, that the supplies could not move from one point to another because there were no workers in the docks of California. So it is very important not just to have a supply, but to know that you can actually grow sweet potatoes, right? Have a vegetable patch which you can use and continue to develop so that you're not completely vulnerable. We will always be vulnerable because of our geographic isolation, but we can be less vulnerable. And yeah, I would say COVID was the great accelerator. The world as we know it has changed completely. A lot of people are in denial about that, but it's like everything has changed. And so we have to look at our relationship with the earth differently. And it's true that the environment of Hawaii deteriorated from the 1700s onward, but we can still do something now. It's not too late.
Would you say where would you say has probably been the biggest barriers in helping spread the word about sustainability and any challenges that has kind of come up throughout this project with working, building the food systems Hawaii, stakeholder group? Has there been some challenges that you folks have encountered? I'm sure that there have been that are kind of like gigantic, that you feel like is another big hurdle that you folks have to overcome?
Yeah, the thing about the current public health challenges for the world is that they're very abstract. Like climate change is very difficult to understand, right? Sustainability is very difficult to understand, but people understand income, they understand jobs, they understand prices, right? That's your day-to-day life. But when you talk about sustainability and food for the next generation, what are you actually talking about? Very difficult to understand. However, if you work with the land or the sea, you will understand sustainability as a concept because it's real to you. It's real. If you caught so much fish last year and now there's nothing, then it's a concrete experience. That's why I say, it is so important for people to experience food production or food gathering, because that's the time when they understand the concepts of sustainability, the concept of climate change when your crops get destroyed because of the weather. That's why I said COVID has changed everything. And in relation to the food system, we have to use this moment for people to learn about what it is we need to survive. That's what COVID taught us, right? If you have to stay home, you're going to do it. But what are you doing when you're staying home? You can plant, right? You can produce food. You can do stuff. So we have to, I think we need to adapt to the 3 Cs as we see it, right? As we hear it. And yeah, the biggest challenge is that the concepts that we are dealing with are so abstract, right? They're abstract. Sustainability, what does that mean to an ordinary person?
Mhm.
To a worker, right? To a worker in a construction company. What's sustainability? Or what's climate change? So working with the environment for me, hands-on,
Mhm.
is very important post-pandemic.
Thank you. Thank you for that, Susan. We actually had a couple questions come in. One person had asked, what factor does tourism play in food insecurities of the Hawaiian community?
Okay. The tourism sector can work in favor of local production and local food in Hawaii. We just have to consciously do it. And there have been efforts to get our hotels and restaurants to commit to buying more local food. So it's not a zero-sum game, it's not like one or the other. Tourism is very important to Hawaii. Otherwise, what are the jobs going to be right now? So many of the jobs are related to tourism, but can we direct the tourism industry towards supporting the local farmers? Absolutely, I think yes.
We had somebody, Dr. Kaleo Patterson said that they out of COVID, they had created 6 food distribution sites in central Oahu, over 100 volunteers and many community partners. They had just received a national grant to organize a central food security and disaster preparedness collaborative involving Wahiawa, Whitmore, and urban Honolulu. Oh, that's amazing. Congratulations.
That's amazing.
And they had asked, this is his plug, if you could help support with education on food security. So I got his contact over there. I got his contact.
Yeah, sure.
Happy to connect.
Yeah.
Folks.
The way this works is that we all help each other. That's why I was saying that Hawaii has the values are relational. Like we like to help each other. It's not always about you buy this, I sell that. That's not what Hawaii is around. So we're happy to collaborate and to help you in whatever way we can.
Yeah, that's awesome. That's so exciting. Okay, let me copy this down. Question, just kind of hearing about all the food systems work that you folks have been doing and just building again that Hawaii transforming the food system. Were there other states or countries that you folks had learned from that already had an existing model that was maybe not, fully successful, but it was something more of a launch pad to maybe could have helped with programming, planning some of the activities and guiding some of your work? Have you guys been able to identify some countries and some other states that have been doing this work?
Yeah, Transforming Hawaii's food system actually consciously interacted with New York City. So we've had New York in our advisory committee meeting, San Diego, right? And we have a review of more than 20 municipal food systems, looking at what are the features of each of these and which ones can apply to us. Now, offhand, we share a lot of concerns with Alaska because of the geographic isolation. Puerto Rico, Guam, because of the island nature of Hawaii. But we really need to come up with our own version of how this is going to work because the dynamics are very different. I mean, California, which is one of the biggest food producers, I think, in the world, right? has a very different dynamic. There's a lot to learn from them, but a very different dynamic. And so when we're looking at the geographic isolation of Hawaii, we have to think about island systems and island economies. And that puts us in a category which is very much like the rest of the Pacific Islands. But we're doing much better because we do have access to resources from the mainland. So
Great. Okay. Let's see. Somebody had a question that pops up. Do you see an issue with people sourcing food from places they normally would not just be able to get up and pay for? So as an example, going to a grocery store, an outlet, or food storage versus their everyday grocery. Oh, sorry, let me rephrase that. So their example was going to a grocery outlet or food storage versus their everyday grocery store. Is there a difference in quality? Is there a difference in quality and health related to the food, or is it all the same? What would you say?
oh, say it again. I didn't understand the question, Malcolm.
Okay.
Like
So the question was, do you see an issue with people, this is our own opinion. Do you see an issue with people sourcing food from places they normally would not, just to be able to go and pay for it? So choosing to go to a food storage or grocery outlet versus their everyday food land, Safeway. Not sure where this.
Yeah. Okay. So let me just say, right, that we have to be practical, right? As I said, there is no country on the planet that sources its food 100%. And there are certain countries like Singapore, for example, or Finland or Norway, where they don't really grow much food, right? So they buy it. Okay, they import it, they buy it. Now, Hawaii got into that model because we were doing so well in tourism. And we thought that if we had money, we can get all the food we want, right? Now we realized that there's a possibility that even with money, you can't get your food. So having said that, I would say that the advantage of buying locally produced food is that we are supporting our local economy. That's the advantage. Is the food necessarily better? I can't say that. I think the USDA regulations are pretty strict. And so whether you're eating your carrots from let's say from California versus the ones grown here, I don't think there would be much of a difference. However, I would say that when you move food from one place to another, sometimes there are chemicals involved that, of course, pass the USDA standards, right? So does the quality suffer? Maybe not. Maybe not. I think imported food is fine. But there is no joy greater than harvesting your own carrot and cooking it and tasting the sweetness from the soil. So I think where you buy it and whether it's organic or not has to have some kind of a difference. But in terms of safety, I think they're all safe.
And to kind of piggyback off this question, they come in and rephrase it. So really the context was that this participant works with a lot of seniors. And that's really their only option. And they have lots of hesitations going to shopping in different areas that they're not familiar to, but also we see the rise in costs or food nowadays. Even just going to Safeway, you can spend a lot of money. So he says that some seniors are often, or they say that seniors are often forced to change their buying habits. Is that kind of the same issue for fresh foods? Is that something that you see on the different populations, that they're probably opting not to make their own food? Because right, some senior housing, I don't think they can make their own gardens. I don't know if
That's
they have
true.
the space
That's
to
true.
do that. Yeah.
Yeah. A lot of the seniors who receive food through the distribution hub tell us that they'd like to have seeds, but they have no place to plant. And so that's a challenge. And Hi-Fi is actually working with the Department of Health on a model for public housing and community gardens. And I was just talking before this webinar. I was just talking to someone from City County who's in charge of the gardens, and we're thinking about how do we collaborate to make some kind of food production possible, even if it's just a little pot. So I have an interesting story. We were at the Council for Native Hawaiian Advancement, and a occupational therapist came and said, can you help me? I said, yeah, what would you want? What do you think how can we help you? And she said, she has this patient who she visits. The man lives alone and has an amputation. And when you enter his small dwelling, right, he has stocks and stocks of noodles. But he said, I have stocks and stocks of noodles, but how can I get a sweet potato to add to the noodles? And I was just thinking in my head, I was saying, it's not that hard to plant a sweet potato or have a sweet potato patch, right? You could have a little kind of sack and put the sweet potato there and it'll grow. And so the idea of having just a little bit of freshness, just a little bit of something not processed in the diet is a good start. I mean, getting to 4 to 5 servings of fruits and vegetables a day is very ambitious. That's very ambitious, even for people who have a lot of money. So, but maybe the first step is, let's just have something green on your plate, to start. And can that be something that you grow in a pot in front of your kitchen window? Maybe, right? And who knows where that would lead. So I'm a little bit idealistic and romantic about this whole idea, but that's where things start. In health promotion, that's where it starts, right? If you say you need physical activity, you don't run the marathon right away. You put on your shoes and you walk. Maybe you walk 5 minutes. Next time you walk 10 minutes. And after that, you're running the marathon. Same thing with food security. Maybe you just plant a little herb somewhere, or you have a pot of green onions. I'm good with that as the start.
Yeah, you got to start somewhere. All big farms started somewhere.
Yeah.
We had a question come in on the chat. They were interested in your thoughts about U.S. tariffs on other countries' food. Would a reduction in tariffs make food more affordable in Hawaii and other states in the U.S.?
Okay, this is a touchy topic because of the Jones Act.
Yeah.
All right,
and I don't space over here. It's only 80 people on the call.
Yeah, I know.
Watch it later on.
Next thing I know, I might get a federal call. All right, so I don't want to comment on tariff because I don't know that much about it. I know about tariffs in other countries like the Philippines, like Vietnam, like Cambodia, where I have done some work, but I can't comment on the US. I don't know what our rules really are in Hawaii on importing from outside of the US. I think we are mainly importing from the mainland.
Okay. What question had popped in? Oh, yes. So folks who are asking, yes, this webinar is recorded, and I will also be sharing Dr. Mercado's slides following this presentation. And with the YouTube recording, feel free to share it with your networks however you want. It is a live video, and I keep it on for a couple years. So until that video has been dropped off, feel free to share with your networks. I actually did see a comment come in on oh, no, somebody had just said, to comment, to support your conversation, that folks can start small in pots, and that we do have to rethink the where and
I
how,
agree. Yeah.
and how food can grow. This participant said that they grow sprouts and microgreens in their canning jars. That's awesome. I don't have a green thumb. I'm working on getting my green thumb. I think it's a learned skill over time. I just have killed a lot of plants but I will try, I am trying.
I'll tell you, Maka. I didn't know I could plant anything until I turned 50. Someone gave me an orchid and said, you can propagate that. And I said, really? And so I read about it and studied it and started doing that, dividing the roots. And then I had so many orchids. I said, wow, I can do that. How about lettuce, right? And so that was the start of my own transformation into somebody who could produce food. I never studied it. I'm a doctor. I don't know about plants, but I learned from trial and error and then from simply enjoying it.
Oh, a lot of mahalos coming in. And I'm glad everybody enjoyed the presentation.
Thank you, guys. Thank you so much.
Maybe we can end this a little early. I think folks, if we can kind of wrap this up. If you had any last minute, takeaway message, we have about a minute or so before I close up, if you have any last minute messages to give our remaining participants for the call. Anything?
Well, first of all, thank you for being here. And thank you for being open. I can see, as I can see in the chat, being open to this idea. I really believe that change starts with people, with individuals, and in small ways, right? Sometimes we want to have big, enormous changes that impact on the whole world, but actually everything that has made a difference starts small. And so you can start small and you can start now. Thank you.
Well, that concludes our presentation with her, everybody. Thank you so much for jumping on the call. Just as a quick reminder, I will be sending a mahalo email to all the participants that have joined today with the evaluation link, as well as presentation slides and the recording. Please submit your responses on the evaluation form no later than next week, Wednesday, so I can have you folks down for earning a certificate of attendance. Thank you, everybody, for joining. Happy Aloha Friday for those who are still on, and I hope you all enjoy the rest of your day. Thank you, Susan. Mahalo, everybody.